Monday morning, everyone, and happy start to an amazing week. And welcome to Connections Online Studio and to our live chat. I'm Nat, Connections Director of Communications. And this morning, I'm re-welcoming, and so I'm thrilled to welcome Quelen Farias to our online community. Thanks so much for joining us again, Quelen. This is amazing.
Thank you for having me again. It's exciting.
It is, yes, definitely. So just quickly about Quelen, and then we'll go into our questions and whatnot. So since 2013, Quelen has practiced in the orthopedics, geriatric, and pelvic health fields. As a physiotherapist, Quelen has covered several aspects of pelvic health, including prenatal care, postpartum health, bladder and bowel health, sexual health, and complex pelvic pain. And this morning, we'll be chatting about menopause and pelvic health. Last week, we actually chatted about periods in pelvic health. So if you want to go and check that out on our Facebook page under videos, you can see that one there as well. So before we begin, I just wanted to quickly say hi to all of our viewers. Make sure to introduce yourself, though we can kind of see eyes. We can't actually see you. So you have to kind of say a quick hi so that we can see who's watching. And just to note that if you do have a comment or questions, it might take us a bit to see it just because there's a bit of a lag. So, Quelen, so I'm really excited to be talking about these topics with you because I think we just don't talk about them enough. And of course, the perfect platform is on Facebook. So,
yeah.
So we'll try our best to kind of use, well, whatever language we can. I'm sure that Facebook probably won't shut us down. I think it'll be okay. So my first question is, when we talk about pelvic floor, what exactly are we talking about?
Okay, so when we talk about the pelvic floor, we're talking about muscles, a group of muscles that we have in the pelvic area. So if you heard about Kegel exercises, I don't know if you go online, it's very easy to find that. Most people I talk to, they know what they've heard about Kegel exercises. So a Kegel is a contraction of the pelvic floor muscles. So usually people will do Kegels to strengthen the muscles, right? And Kegels can be okay, but sometimes they're not the best option for you. So it's important that you know what's happening with your pelvic floor to know if contracting those muscles would be a good idea for you. Because of course, if you're already holding them tense, then Kegels may not be the best friend. But anyway, so these are your pelvic floor muscles. They are, as the name says, they are the floor of the pelvis. So not the abdominal area, although they do work with the abdominal muscles, right? And not the buttock muscles, although they do work with these muscles too. It's just really the muscles between the pubic bones in the front here, and they go all the way back to the tailbone. Okay, so the bottom area, those are the muscles we're talking about. And they're very important for bladder health, bowel health, sexual health. They're also part of our core system. As I was saying earlier, they work with the abdominal muscles, with some of our back muscles. They even work with the diaphragm, one of the main breathing muscles. So even our breathing can interfere with pelvic floor function. So that's another conversation. But just so you can see, right, that these muscles, the pelvic floor muscles, we talk about them, and we don't talk about them enough, but they're very important muscles.
We don't. And I didn't even know that they worked so closely with the stomach muscles and the diaphragm. That's really interesting.
Yeah, they work as a team. Yes, they work as a team. So even if we were talking about, for example, incontinence here today, a lot of people, they leak urine when they cough, when they sneeze, when they run, when they jump. And that's usually a pressure problem. And so when we work with our patients for that, we don't think just about the muscles on the bottom. We have to think about the system above, see what's happening there. How are we managing the pressure that was sending down, right, towards the pelvic floor? So sorry, my cat. My cat.
No, that's okay. I see you moving away, so no worries. So how does menopause then actually affect our pelvic floor health?
With menopause, many changes come, right? And even in our muscles, not just the pelvic floor, right? Things can change. What I find is also the hormonal changes. So sometimes what happens is with the hormonal changes that may happen with perimenopause, that period before menopause and menopause, for some people, they may start experiencing more symptoms. Let's say they already had a little bit of incontinence, and then they come to see us. Oh, I don't know, I'm just, I'm in menopause, and now I'm noticing I'm having less and less control of my muscles. And that could be, just the muscle strength that's changing there. Sometimes they will come to us and say that they've been experiencing bladder urgency, frequency. They feel like they have to go to the washroom all the time. Or when they go, they feel like they're not emptying properly. And sometimes they may even leak urine in that situation because they have that sudden urge and they feel like they have to rush to the bathroom. And sometimes they don't make it. And during perimenopause and menopause, if that was not a symptom before, it could be, or even if it was, as I said, if it was mild and now they're noticing it more, it could be due to the changes that are happening in that specific area, around the vaginal area, around the urethra. The tissues can change that and can irritate that area, right? So, and that can cause then pelvic health symptoms. For some people, they may have pain with intercourse during, this phase as well. Some people, they may start noticing a scar they had when they gave birth years and years ago, right? So now, all of a sudden, they have some maybe pain in that area, and that, I would say, could be because of the change in the tissues as well. And even if it didn't start as a muscular symptom, what we see, the scenario that we see a lot is people start experiencing all these symptoms, and then the response is to tense up those muscles as a coping mechanism, right? That we see this, I know I talk about this all the time because we see this all the time. And then next thing you have is just muscles that are tight, and then they may become weak as well, right? Because they're not moving. So it's a combination, right? Even if it didn't start with the muscles, the symptoms of menopause can cause those muscles to become more tense, for example, and then they will also become weak. It's
Yeah, and then it creates pain as
a
well,
nasty
right?
cycle. Yes, not a
Yeah,
good cycle.
yeah.
Yes.
And so when I was doing research about, what questions to ask and whatnot about menopause and pelvic health, I came across pelvic organ prolapse. So what exactly is that, and what are the symptoms we should watch out for?
Yeah. So pelvic organ prolapse can happen at any time, right? It doesn't necessarily happen with menopause, but maybe again, as I was saying, people may notice symptoms more now with menopause, right? As I was saying with the other symptoms. And pelvic organ prolapse is when any of your pelvic organs, think about the main organs we have in the pelvis. We have the bladder. For most of us, I would say we have the uterus and we have the rectum. These are the main organs there in that pelvic bowl there. And what happens with the pelvic organ prolapse is any of these organs, they can start shifting downwards towards the vaginal opening, most commonly. Okay. And it can be a very kind of small shift, and then people don't even know they have anything. And it's quite common, actually, maybe I don't know if I can say normal, but it's okay to things change, right? So sometimes you do have a little bit of a shift downwards of the vaginal walls, but that's completely okay. You don't have any symptoms, you're doing fine. But sometimes people start having symptoms, and they may come to see us and say that they have this pressure sensation in the vaginal area, or this dragging sensation. Sometimes they may have difficulty emptying their bladders or the bowels, depending on the prolapse, because it can be the bladder shifting downwards towards that front vaginal wall. It could be the rectum shifting downwards towards that back of the vagina there, and it could be the uterus itself. It can be a combination of the three. Prolapse is a tricky condition, and the symptoms are very subjective. Some people, they have, in the physical assessment, you can see clearly they have a prolapse. You can see a protrusion, a bulge in that area, and they're completely fine. They don't even know, they don't have any symptoms, and that's great, right? And some people, they may have a very small prolapse in the physical assessment, but it is bothering them. So it's a very personal experience. So you have to see. But anyway, yeah, that's what, in a very simple way of explaining, that's what a prolapse is.
Now, I've heard as well that with the dip in estrogen levels, and you did quickly talk about it earlier, you didn't mention it, that during menopause, it can trigger pelvic pain. And then you also said that it can during sex as well. So maybe you could tell us a little bit more about that.
Yes. So yeah, so it can change, and that can happen. I actually see that postpartum as well. So not just with menopause. So when women they just gave birth, they're breastfeeding, their periods are not back, so that area can have less estrogen. Also, like it happens, similar to what happens with perimenopause and menopause, and they may start experiencing pain in that area. And that pain, of course, if the area is more sensitive, then if they try to have intercourse, that may trigger pain when they're trying to have touch that area, have vaginal penetration, right, with intercourse. And so it happens so much, but people don't really know what to do, so they start using lubricants, and some people, when they come to see me, they've been already, this has been happening for a long time now, I just don't know what to do anymore. And at this point, I'm not even trying, because why try, right, if it's painful?
Yeah, and I'm sure as once you have that pain, then you kind of, your reflex is to be more,
Yes, then again, yeah.
psychological as well. You're kind of thinking this is going to happen again, so it's hard to kind of work through those.
Yeah, and people don't know that they can do something about it, right? So, but you can please go talk to your doctor, because if it is a good option for you, they can prescribe topical estrogen that's different than that systemic kind of hormonal therapy, something that you apply only in that area, and it can be very helpful. But that's something that you have to discuss with your physician, because we have to take a look at your medical history, right, and see if that's okay. But also out there, if you go online or even go to shoppers, we now have good vaginal moisturizers that you can buy over the counter that can be very helpful. So you can do some research on that. So sometimes starting with something simple and see if that's enough, right? But then don't leave it just be like that, and go talk to your doctor, because it could be that there is the lack of estrogen, but it could also be other skin conditions in the vulvar area. So you want to make sure that that's not the case.
So when people come to you, because you're a physiotherapist, right? So is there exercises that people can do to kind of help as well from home?
Well, yes, because if it's mainly the tissue there and the muscles are moving well, so then I have to, if they're not doing the estrogen or the topical moisturizer, if they haven't spoken to their doctors, I will just send them back, right? So because we need to treat that. You can't just ignore that, right? You can't change the tissues just with exercise only. So, but then of course, on top of that, what we see usually is that the muscles are tense, because as you were saying, they start protecting. So yeah, so I teach them how to relax the muscles. We work on the entire system, right? Breathing exercises, getting the full body moving, not just the pelvic floor, but in a way that they learn how to relax those muscles. In some more, let's say, advanced cases where there's a lot of changes in that area, people cannot tolerate vaginal penetration at all, then sometimes it can be helpful to add some devices that can help with just gradual vaginal penetration. So for them to work on that fear also, and on their own, right, instead of having a partner right there, but also to just help with releasing the tissues in that area. It's really working with the body, but also with the nervous system a lot.
Sure, yeah, for sure, because you have that fear, right? So definitely, yeah. Well, thank you so much, Quelen. This is wonderful. I didn't see any questions come up or anything, but if anyone does have any questions, please feel free to add them in the comments, and we'll come back later and look at them and whatnot.
I'm going to add, again,
sure.
the same idea as last time, the website. There's a good website if you want to share with people, as this website called, what's the name? Menopause and U, but just the letter U.
Menopause and ANDU. Okay.
.ca.
Let's see.
And then again, these are the Canadian, gynecologists and obstetricians association, and they have this great website. It's a full website with information. So if you want to go there, I think it's a good start point.
Yeah, for sure.
Yeah,
And that's the Canadian one?
Oh, I can see Sarah's comment. I didn't even know I could see the comments here.
Yeah.
Yeah.
Oh, hey,
Thank you, Sarah.
Sarah's just saying it's also interesting to listen to Quelen. Yes, Quelen has so much to share. And like I said as well, make sure to go check out last week's as well on periods and pelvic health, because these are topics that we really need to talk more about. I know it's a little harder on Facebook, I think, but we're still using those words, right, Quelen? So I think we're trying to break that taboo as much as we can.
Yes.
A little harder on Facebook, but that's
Hopefully,
okay.
hopefully we'll be okay.
Yeah, hopefully we won't get shut down, but I'm sure it'll be okay. So far, I think we're good to go.
Yeah.
Yeah, for
and
sure.
people can, so this website, they have a lot of good info there.
Okay, I'm going to find it. I think I found it here. It's the Society of Obstetricians and Gynecologists of Canada. I think that's right. Okay.
They have the one, yourperiod.ca, the one that I mentioned last time.
Yes. Yeah.
That has a lot of info there. It's a great, complete website. There's just so much info there. Yeah.
Yeah.
And that's what my doctor, that's what she follows. Even if I ask her about something else, she says, Quelen, go to this website, because there's a lot of research on just coming with this website. So you know that the info there is good info. Then you can bring that to discuss further with your doctor if you see anything there, right?
Yeah, and that's, I think, what's important is that to advocate for yourself, right? To go research the information, to go back to your doctor, and to make sure if you're having pain, if there's any discomfort, to really see
bladder symptoms,
right?
but they're very common, but they're not normal, and you can do something about, right? So just talk to your doctor. And nowadays, I think most my patients, they come from referrals, I would say, still. So doctors, they do know we exist, and it's not just for bladder symptoms, right? So, but if your doctor is not familiar with pelvic physio, you can bring up the subject, right, and see. Yeah. And you don't actually, nowadays, you don't even need a referral with most insurance companies. You can self-refer for physio in general, but for pelvic physio as well. So a lot of our patients, they also just come to us after doing some research.
Yeah, and that's great. That's great that they're able to do that as well, right? Because then if it's harder to reach out, to get the doctor to understand than going right to you, and then you could help.
But I think things are changing now. More and more doctors, we see a lot of patients coming from the specialists. They already went to see a urologist or a urogynecologist, and they are the ones sending their patients to see us. So,
yeah, I think that more and more people are talking about it, and I think it's so great that we are kind of getting, that information out. And Sarah's just asking, does it exist a cheat sheet of the various symptoms about menopause?
Yeah, I say that website, if you go, it says, it starts with perimenopause, right? And it says your early warning symptoms. So I think it talks about menopausal symptoms, hot flushes, night sweats, palpitations. So there's so many, and we can experience the symptoms in so many different ways, right?
Yeah.
So other than just the periods becoming more irregular, I think noticing if there's any change, right, in your general kind of well-being, let's say, right? But I say if you go back to not the website, the Menopause and You, so that's the one that has it. And then they have a list here
of tons of information.
And then they actually talk about each symptom that we wouldn't have time to do this here, of course, but they talk about each symptom. Because if let's say, if you're noticing change in your sleep patterns, then you can come here and read more about it. Right?
Yeah, because it really does affect your sleep patterns. I'd look it up as well. Yeah, definitely.
Yeah. So unfortunately, right, so many things. And in this website also, they talk about just kind of healthy lifestyle things that you can do to help. We cannot guarantee, but just to try and help. But that's I think is the rule for everything else, right? For your general health, right? To be active, to eat healthy, avoid alcoholic beverages, sugary foods, and processed foods, just to help in general with your health. And I think that could also help with menopause symptoms just speaking in a very general way. Right?
Definitely, like healthy living and whatnot in general. Yeah, and even just getting out and connecting with people and talking about, the symptoms and is another great way to kind of help, as well as your mental health, right? So definitely,
Oh,
yeah.
yes.
That looks like there's tons of information on here. It's really amazing, actually. I'm gonna have to go check that one out.
Yeah, no, it's a great resource, and I like it because I like because it's from the Canadians, right? Gynecologists, Canadian gynecologists and obstetricians. So it's a safe resource, I would say, and then from there you can go further looking into other things that are more that you relate with more, right? Because we don't have all the symptoms, and some people they may have all the symptoms, and some people may not have any. Because then they will also in this website they will talk about treatment as well, right? Not just in terms of physio, but the medical treatment that you can discuss with your doctor, right? The hormonal and other ways that you can try to help you coping with some of the symptoms.
Yeah, definitely important to check that one out. And I made sure to put both links as well in the chat here so
Cool.
everyone will be able to see it also. So yeah, so thank you so much, Quelen, for joining
Thank
us
you.
this morning. I really appreciate this. We're going to have you out again on to do another
Yeah,
few
think
to talk.
about other topics and then we can do
Yeah,
it.
for sure. And just to thank our viewers as well for coming out. And don't forget, tomorrow morning, Michelle will be on at 9. She'll be talking about digital literacy with Krishnan from the Western Quebec Literacy Council. So have a great day, everyone. And thanks so much again, Quelen. And we'll see
Bye. Thank you.
you
Have a nice day.
You too.